Well, good morning everyone, you are most welcome. Now, before we look at some of the dramatic developments that have happened around the world today, I just want to look at some research from China, because this sort of informs the pattern of spread that we're seeing. And this was published in Practical Preventative Medicine, written by Chinese epidemiologists and translated from the Chinese. And it relates to a study on a bus. Now, a bus passenger infected a fellow traveller sitting 4.5 metres away. So they looked at the CCTV footage of this bus. They worked out that this person couldn't have got infected any other way, but he got infected from someone who was sitting 4.5 metres behind him. This shows how this virus is transmitted in closed environments, in a closed-in bus, in cold weather. So closed environments, crowded environments, like buses, are going to spread this infection. So that gives evidence for that. And this is about twice the distance we've normally recommended as being a safe distance. So in closed environments, proximity becomes less of an issue. We're talking about 4 metres or more here. Closed environments with air conditioning, the transmission distance of the new coronavirus will exceed the commonly recognised safe distance. Now, they also showed that another passenger who got on the bus 30 minutes later was infected by a passenger who'd got off 30 minutes before who was infected. And again, the Chinese epidemiologists did a lot of work on this. They were able to eliminate other causes of infections. And they concluded that the virus had been in the air in the bus for 30 minutes. And they concluded that it was in the air in the bus, not from a surface, because the passengers were on different parts. They travelled in different parts of the bus. And the same study also studied how this virus, the COVID-19 virus, can survive on surfaces. And it can last on surfaces at 37 degrees centigrade, 98 Fahrenheit, for 2 to 3 days on glass, fabric, metal, plastic or paper. So even when it's warm, it can survive for several days. So this does explain why we've seen spread in Singapore, Hong Kong and warmer parts of China and southern parts of the United States. So at lower temperatures, the assumption would be, although that's not published in this particular research paper, is that at colder temperatures it could survive for considerably longer than that. And the other thing that people still really aren't taking full cognizance of, in my view, is that the virus can survive for 5 days in human faeces or bodily fluids. This clearly puts people working in drains and sewage facilities at a level of risk. And it also shows the massive importance of meticulous toilet-related hygiene. So when we look at this new data coming out of China now on the epidemiological modalities of spread, it does somewhat inform the rapid amount of spread that we are seeing around the world. Now let's go on to what the WHO is saying about this. Now the WHO is saying the virus has a foothold in many countries, so there's a real threat of a pandemic. Well, this just doesn't really merit comment. I mean, the World Health Organization has lost all credibility here. To say there's a threat of a pandemic when there's patently a pandemic, they just lost credibility here. Now, it's not saying they don't do a lot of massively good work. They do, and I'm a great supporter of the WHO. But there is a mismatch here between their public statements and the good work that they can actually do on the ground, such as supplying expertise, such as this team they sent to China to gather data on the ground, such as the personal protective equipment and test kits they've been sending around the world. So they do a lot of good work, but this, to my mind, this sort of thinking just does them no good whatsoever. But hey, they're the World Health Organization. China has had very few new cases. The containment measures, the social isolation measures in China are working very well, it has to be said. Although they are quite draconian measures that they're taking. But the key thing about China is that they are bringing the people with them. People understand. I've been getting quite a lot of emails from China and correspondence from China. And people understand. They know why this is necessary. And I'm not sure we're at this stage yet. I'm not sure the population in Western countries is moving with us the way it has in China to bring about this dramatic improvement, and it is a dramatic, sensational improvement. So when the World Health Organization says this virus can be controlled, they're absolutely right, but we need to behave like the Chinese. So from this appalling start that gave the virus a foothold, the Chinese have done amazingly well. And this reminds us of this new trusted saying that we have. Healthcare must be of the people, by the people, for the people, to paraphrase the great Abraham Lincoln. Now, what I'm saying here is that it's no good for governments just to say, do that, do this. Or for doctors to say, do that, do this. People have to understand. And when they understand, most people are reasonable and will go with you. They don't want to get the infection. They don't want their family to get the infection. They don't want their business to be suspended longer than normal. We have to move on this together. This is a common enemy. And I think the Chinese people have realised that the health of the country is of the people, by the people, for the people. And I don't really think we have realised that fully yet, and are not moving together collectively as the population in China now is. No new cases outside Wuhan city for 4 days. That is just incredible. And that includes Hubei province. No new cases in Hubei province or any other places in China because of the isolation measures that have been taken and the compliance of the population with those measures. So really quite impressive. Now, the United States is quoting 754 cases. Now, again, the United States is just losing credibility by this apparent denial strategy, and the testing is still lamentable. So let's just look at some research from that. Don't take my opinion of it. This is the Cedars-Sinai Medical Center, 9th of March. Sophisticated mathematical modelling based on all sorts of things like flights to China, transmission characteristics of the virus, known cases. And by the 1st of March 2020, they're saying they've estimated between 1,043 and 9,484 cases in the United States with community transmission, the amount of people infected. And of course, this is a few days ago now, so it would be surprising if this number hadn't at least doubled. So the reality of the situation in the United States, I'm afraid, is not reflected by this kind of figure. So this is the Cedars-Sinai Medical Center. Our model suggests that even moderately effective population interventions to reduce transmission can have a profound impact on the scale of the epidemic. Well, we know that from the Chinese data. We know that from the case study of Singapore, which has very successfully controlled the spread of this virus. Hong Kong also, and Taiwan. So there are these, what you might say, glowing examples. China, Hong Kong, Taiwan, and Singapore, of how this can be contained. So we have these models. Really, we need to learn from these, what we could only call real-life experiments. But at the moment, in Western countries, we're not moving from them because we're still reacting. We haven't moved on to proactivity, and sometimes we're not even reacting. I've had quite a few emails from doctors in the United States lately who are saying that, and emergency nurses in the United States that are saying we're not even reacting to things, never mind being proactive, for a sophisticated, intelligent, advanced country. I'm not slagging off the United States. I'm going to have plenty of criticism for my country in a minute, as I did yesterday. So the finding supports the role of public health interventions in controlling the disease. That's the same Cedars study. And we know what needs to be done. Steps already suggested by public health experts: promoting social distancing, personal hygiene, restricting large-scale gatherings. All these need to be done, but in many cases at the moment are simply not being done. Although I'm going to look at some examples of where it is being done. But the United States is behind the curve on this, I am afraid. Now, I've had quite a few emails from health workers in the United States. Mass screening for infected individuals has cost implications. Now, I believe that the tests are free. This is my understanding. The tests that are available. But the state of testing, I mean, there's supposed to be hundreds of thousands of tests being rolled out this week. But as far as I know, the testing in the United States has been limited to a few thousand tests still. The testing is still way behind the curve in the United States. I'm really hoping that's going to massively change this week. Certainly the political declarations and the statements for the Centre for Disease Control indicate that they are getting their act together on that, but it doesn't seem to be filtering down to the ground yet. Now, one problem I've been told by an emergency worker in the United States is other infections are supposed to be excluded before COVID-19 testing. And the point is, that means you might need to test for influenza, other viruses, bacterial infections. And of course, this testing is all very expensive. So someone might go in and say, I need a COVID-19 test, and the doctors will say, well, you need tested for other things first, and that's going to cost a lot of money, and people often don't have access to that kind of money. So this is a direct quote from an American emergency doctor from an email who will remain confidential. People in the US will avoid treatment and testing due to our insurance system. Cost implications of that. So it's not like South Korea where we have a drive-through system and you're just tested for COVID-19 and nothing else. It's surrounded by this complexity at the moment. And apparently, correct me, brothers and sisters and friends in the United States if this is wrong, but a single visit to the ER can cost $700. I mean, that is a lot of money. It's a lot of money for many, many people, a heck of a lot of money. And of course, could have 2 or 3 family members. It's this is going to put people off going and put people off being tested. Meanwhile, there's community spread. Someone needs to take some serious decisions and get this testing out there, because at the moment, the reports I'm getting indicate that it's not out there. So the situation in Italy, all of the country is now locked down. It's all one zone. There's no red zones anymore. The whole country, 60 million people. Public gatherings are prohibited. Sports events are all cancelled. All educational establishments are shut down. Schools, universities, everything. People returning should be self-isolated. So what I mean there is anyone coming back from Italy should self-isolate. So there was lots of aeroplanes full of people came back to my country over the weekend from northern Italy. And I don't know if those people are self-isolating. My health authorities, as far as I know, don't know if those people are self-isolating. I would appeal to them to self-isolate. But we simply don't know if they're self-isolating or not. This is why we've got to move together. You know, these people need to realise that it's of the people, by the people, for the people. Italy, great increased number in cases. The death rate in Italy is frightening me, I must say. I'm not going to pretend it's not frightening me. Now, the reason might be partly the older makeup of the population in Italy, because as we've looked at before from this huge epidemiological study in China of over 7,000 cases, I think it was. In fact, it might have been 70,000 cases. Anyway, I think it was 70,000 cases. All the patients that had it in China up to the 11th of February. Yeah, it must have been 70,000 cases. So huge epidemiological study in China. These are the ages and these are the percentage of deaths. Thankfully, no children recorded. Low death rate, well, still 0.2. It's still way higher than influenza in younger age groups. But in the older age groups, so 80s, people in their 80s, 14%, nearly 15% died. People 70, 79, 8% died. Case fatality rates. 60 to 69, 3.6% died. 50 to 59, 1.3% died. So the older demographic makeup in Italy may partly account for this, but I don't think it fully accounts for it. There's something else I don't quite pretend to understand happening here. So, yeah, am I frightened by that? Yeah, I'm not going to lie. I'm frightened by that death rate. Resorts, all the ski resorts are closed. Now, been riots in 27 prisons with some escapes and 7 prisoners have died. I think a few were due to methadone overdoses who broke into medical facilities and overdosed on methadone. Now, the doctors, nurses in Italy are treating masses of this condition described as bilateral interstitial pneumonia. This is what is causing the deaths in Italy. So what's happening here is, if these are the lungs here, so the main airway breaks down into these, the right and left main bronchial passage, the trachea, that goes up to the mouth and the nose up there. So the air's going in through the nose, the air's going in through the mouth, down the airway, down these right and left main bronchus, and into the lungs. So here we have the lungs here, like that. So the left lung, so they're the lungs. Now, what's happening in pneumonia is there's areas of consolidation, as the Italian authorities have told us, bilateral interstitial pneumonia. Interstitial means in the tissues. Bilateral means it's both sides. So what they're seeing on their x-rays is bits of pneumonia affecting both lungs. And these will appear as white areas that are quite easy to see on x-rays. The lung fields themselves are dark coloured, because what is happening here is the small airway. So you might know that these break into these keep breaking down into smaller and smaller passages till we get to these microscopic bronchioles, into these alveolar air sacs here. And what's happening is these alveolar air sacs are simply filling with inflammatory fluid. So on a small scale, that's what it looks like, and that's seen as these bilateral pneumonias with infiltrates of fluid in both lungs. This means that the oxygen can't get out into the body, and it means that the carbon dioxide can't get from the body into the lungs to be breathed out. Clearly life-threatening situation reflected in this appalling number here. So that's what they're seeing. Now, I have had emails from quite a few Italian hospitals. Now, I can't substantiate them. They're just single emails from concerned nurses and doctors in Italy who've taken the trouble to write to me in English, which I appreciate. And I'm not going to give you some of the details. It is disturbing, but let's just say that very difficult decisions about priorities have to be made, and are being made in Italy as we speak. Because basically the hospitals are struggling to treat everyone that needs treated. Milan hospitals are full. Other treatments stopped in many hospitals. So the wards are full up with these patients with pneumonia. No spare ventilators. The situation has been described as critical by Italian doctors and Italian politicians. And this has been a concern from the start. One of my concerns, if there's a glut of people all at the same time, we are going to really struggle to treat them. In fact, I'm understating this. If there's a lot of people all at the same time, we can't treat them all. And countries with poorer health, weaker healthcare systems are going to be hit even harder. Italy has an advanced healthcare system, and yet these great difficulties, and poorer countries, it's going to be even worse. Now, Germany increasing cases, France increasing cases, Spain a dramatic increase in cases. So plenty of cause for concern all over Europe. Now, South Korea, the third worst affected country after China and Italy. A lot of confirmed cases, but the death rate is remarkably low. Now, this is encouraging, because I think this low death rate might be due to the phenomenal levels of testing. The Koreans are doing more testing in a day than I believe the United States has done. And this is throwing up a lot of people with milder disease, or even asymptomatic disease. And because they recognise a greater number of people that are infected, that means the proportion of deaths go down. So I'm still hopeful that this might be nearer the actual case fatality rate, although it's still too early to tell. And this, to be quite honest, this doesn't quite match in with the data from Italy. Now, the thing about the data from Italy and the data from South Korea is we know this is all genuine data. So we need to work out how to explain this. There's no ambiguity about the reporting in South Korea and Italy. They're both advanced countries, sophisticated countries that will accurately report. So South Korea doing well. Number of new cases decreasing because of the social isolation measures, copying the China, Singapore, Hong Kong, Taiwan models of public health intervention. So terrible situation, but this number, I know it sounds high, but it's actually remarkably encouraging. Now, the UK was starting the Cheltenham Festival with 250,000 people attending. And I'm not going to comment on that. It's just, anyway, that's what's happening. In 2 weeks' time, apparently, respiratory symptoms will need self-isolation. But I would say if you've got a dry cough, a fever, achy muscles, undue fatigue, shortness of breath, you should be self-isolating now and contacting 111 immediately. Now, Romania, I haven't got this confirmed, but this is people in Romania have emailed me with this information, and this is encouraging. Romania is being proactive here. This is encouraging. They've suspended flights to and from Italy up to the 23rd of March. Romanian citizens coming from affected areas are allowed to enter but must quarantine for 14 days, and I believe they have mechanisms in place to make sure that's done. So two great contrasts with my country already. We've still had flights in from Italy over the weekend and are still having some flights to and from Italy. It just beggars belief that the country can be shut down, but we're still flying in and out of it to some extent. And I know lots of people arrived back from Italy over the weekend. And we said, ask them nicely to self-isolate, but whether they are or not, we don't know. But the Romanians are actually doing that. So the Romanians have stopped the flights, my country hasn't. The Romanians are insisting on 14 days quarantine. We are merely suggesting it. In my country, we're having the Cheltenham Festival with 250,000 people attending. In Romania, all events with more than 1,000 participants are banned. Events with less than 1,000 participants need to be approved by local authorities based on a case-by-case analysis. And schools in the entire country have been closed down till the 22nd of March, with plans to extend the deadline if necessary. So my country is doing none of these measures. So I'm delighted to see that Romania is being proactive in these measures. Now, as I've said, these aren't confirmed. These are just based on a few emails I've had from Romania, but they are reliable people, so I strongly suspect that is the official situation in Romania. So my congratulations to the Romanian authorities on that. Ireland, 24 cases. Delighted to see that now St Patrick's Day is like a huge thing in Ireland. It's just, St Patrick, the great patron saint of Ireland, and admired in Ireland and around the world. And to cancel St Patrick's Day in Ireland is a huge thing, and I'm delighted to see they've done it, because on St Patrick's Day there's public gatherings, there's meetings in pubs, there's drinking alcohol, there's consequent physical contact that there might not otherwise have been. So the right move. Iran, who knows what's going on in Iran? I've got a few ideas of what's going on in Iran, and basically it's not good. The situation in Iran is not reflected at all. I did learn one tragedy. 30 people in Iran have died of alcohol poisoning because there was fake news or misinformation that alcohol protected people against COVID-19 virus. And of course, some people don't need much encouragement to drink. I don't know what the drinking situation is like in Iran. I assume in Islamic culture a lot of people aren't used to alcohol. So if they drank a lot, it's not surprising that people died of alcohol poisoning. Plus, there might have been some dodgy alcohol around as well. I don't have the details, but let me just be clear, alcohol does not protect against COVID-19. It's good on your hands for washing your hands if it's greater than we can put it on this, our hand gels, but the alcohol has to be at least 60%, and preferably 70% or more to kill the alcohol on the surface of the hands. But whatever you do, don't drink it. That will not help. Right, so we've looked at a few reliable sayings already today. That's another one. That's another one. Pleased to see Prince Harry doing elbow bumps yesterday at his last official royal engagement. So elbow bumps are good. This seems to be the new cultural norm. We don't shake hands, we bump or tap elbows. I've tried it actually. It's actually quite fun. It's a good thing to do. Good hygiene. Keep your hands clean so they don't go to your mucous membranes, because therefore we need to. Thanks for tuning back in.